The conditions that I treat are often ones that last lifelong, so I often see patients for several years. I get to know both the patient and their family, which is really important to me. My goal is to kind of help patients live their best life, let them continue to do the things that they like to do. So knowing a little bit about you helps me tailor the treatment to help you be able to continue to do those things that you like to do. Some of the conditions that I treat include Parkinson's disease, essential tremor, dystonia, and then some other disorders that don't fall under the movement disorder kind of category, like migraines, seizures, and neuropathy. Movement disorders can greatly impact someone's life. If you take essential tremor, it can impact someone's ability to eat, to drink, to do daily tasks with their hands, like button zippers. Other conditions like Parkinson's disease, people can have their walking affected, which can lead to falls, which can be very problematic. So it's kind of a spectrum, but they can greatly affect someone's quality of life. Specific symptoms that may prompt you to see your primary care doctor may be any shaking that you notice, any changes to your walking that are not kind of orthopedic or caused by knee problems or hip problems. If anything seems different just in your daily activities, like your movements are slower, harder to do, those are all reasons to be evaluated by your primary care doc. Typically, what's really important is the history, so we'll talk a lot about when things started, how they've progressed, any new medications you may have been tried on. That's a big culprit for movement disorders, so we like to evaluate that. We'll do a thorough exam looking at your movements, and then after that, we may order some imaging, mainly of your brain or your spine, and then some labs as well. Treatment plans can vary based on the patient, what their diagnosis is, but I like to focus on what the main symptoms are that are really bothersome to the patient and kind of tackle those. Aside from medications, we typically use other things like physical and occupational therapy. Deep brain stimulation is a therapy that we commonly use for patients with Parkinson's disease where their symptoms can't be controlled with medications. We can also use it for essential tremor and dystonia, and it can be very helpful to kind of treat their symptoms because we can modulate and change the therapy over time and treat the symptoms as they arise and change. I do perform injections, Botox being one of those medications. It can be helpful for a wide range of disorders, particularly migraine and dystonia. This can really help with quality of life when medications are not helpful anymore. Being able to see patients come back and seeing that the treatments that we discussed and started have really made an impact on their quality of life is so great to see. It's very rewarding for me as a physician to know that my work played a part in that. MedStar really focuses on treating people within the community that it exists in. I think at MedStar, what's so great is that along with the physician, you also have a whole team of other people with you, including the front desk staff, the MAs, everyone who's kind of here to make your experience the best it can be.